Hello, Mr. Mailer here, online math teacher, and welcome to my channel. Today we're going to be continuing my video series on hypothesis testing, and in particular talking about type 1 and type 2 errors. So if you find this video helpful, consider smashing the like button, subscribing, and let's go. So, in hypothesis testing, we have our null and alternative hypothesis. And our goal is, assuming the null hypothesis is true, find convincing evidence that it is not true, that we should actually be supporting the alternative. So, with this in mind, we call a type 1 error when you reject that null hypothesis and accept the alternative, but that null hypothesis was actually true. Sometimes you might hear this referred to as a false negative, and it is when you report that your results are statistically significant, but they're not here. So, and you can think of this as conditional probably, because like I said, you're assuming your null hypothesis is true, and you're rejecting it. So it turns out the probability of a type 1 error occurring is the same as whatever you set your significance level to. So it's a nice way to compute the probability of having a type 1 error occur. The other type of error you can have is called the type 2 error. That's when you fail to reject your null hypothesis, but it was actually false to begin with. So you kind of assumed the wrong thing. So that's called a false positive. And it's when you conclude there's not significant findings when there is. So there is, you do want to support the alternative. And the probability of type 2 error occurring can be hard to calculate. One way you can think about it is 1 minus something called the power, which I'll loop back to in the second half of this video. So it's hard to compute. We'll talk about it a little bit more at the end. But let's get going. So how do they relate? Well, the more likely you are to fail to reject your null hypothesis, the less likely you are to reject it and accept it. And that's going to impact the likelihood you have a type 1 versus a type 2 error. So you see these pictures here. I've kind of changed the areas of the boxes to reflect if you set a very small significance level, you're going to make it really hard to reject your null hypothesis. So you're going to minimize the likelihood of that type 1 error. But in that scenario, you're going to make it more likely that you're going to cause a type 2 error because of that. Similarly, if you picked a really big significance level, it's going to be pretty easy to reject your null hypothesis and accept the alternative. That's going to make it really easy to have a type 1 error and less likely to have a type 2 error. So these boxes are kind of nice visuals to see how changing the significance level impacts the possible outcomes we could have. So let's look at some scenarios now. So scenario 1 here, a company releases a product aimed at detecting high blood pressure. The product works by measuring an individual's systolic blood pressure once per hour at a randomly selected time throughout a 12-hour period. If the product determines that an individual's mean systolic pressure is greater than 130, then the individual is instructed to seek further medical attention, as this may indicate high blood pressure. So a hypothesis test you could set up is having the mean blood pressure be 130, that's our null, and the alternative being that mean is greater than 130. Because if it's greater than 130, if we find evidence to support that, then that means they may have high blood pressure and they need to seek out help. So if you have a type 1 error, that means we're rejecting our null and accepting the alternative. In this case, doing that would be us reporting to an individual they have high blood pressure, or there's evidence to support they might, so they should seek medical attention, when they don't. Now, the consequence of this is the patient's going to lose a little bit of time, money, and the resources related to the follow-up, but in the grand scheme of things, that's not that bad. That's more of an inconvenience. The type 2 error in this instance, though, when we fail to reject the null hypothesis, when it actually is false, would mean we are reporting to this individual that there's not evidence to support they have high blood pressure when they actually might have it. So what that's going to mean is they're potentially not treating their high blood pressure, and that could have some serious health consequences. So when you think about what type 1 and type 2 error means in this scenario, it's pretty clear that the type 2 error is worse than the type 1 error. So if you're setting up a hypothesis test, you're going to want to do things to minimize the likelihood of committing a type 2 error in this situation. And the two easiest ways to do that are going to be either increase your sample size. So maybe instead of taking blood pressure once an hour every 12 hours, maybe it's once every half an hour for every 12 hours. Or maybe you want to increase the significance level. you increase that, that makes you more likely to reject your null hypothesis, accept the alternative, so the individual is going to be more likely to have to go follow up their doctor to get their blood pressure checked out. So this is one scenario where you could have. Here, type 2 is much worse than type 1. In the second scenario we have, now we're looking at response times for EMS personnel, so emergency medical personnel. And it tends to be the case that in life-threatening injuries, you need to see medical attention within 8 minutes of an accident to really have a good chance of survival. And in a large city, they find that their mean response time for these life-threatening injuries is 9 minutes. So that's bad. People are going to die because the response time is slow. So the city wants to improve this, and what they do is at the end of the year they make some changes to protocols, and at the end of the year they take a simple random sample of 250 calls that involve life-threatening injuries and recorded the mean response time. So the hypothesis test they might run is it either has not changed, so the mean response time is still 9 minutes, that's the null hypothesis, that's what it was before, versus what we would like to find evidence to support is, has this response time improved through our new protocol? So is mu now less than 9? And in this case, if we commit our type 1 error, so we reject the null hypothesis when the null is true, that's going to mean the city's going to conclude that there's significant evidence to say that they have improved the response time when they really haven't. There's not significant evidence. It was kind of by chance they saw this outcome. So what that means is the city's going to be less likely to try to increase the response time because they think it's improving, which means more people are going to die because of the bad response rate. So this is a not so good outcome. So type 1 error is pretty substantial here in terms of how bad it is. The type 2 error, though, when you fail to reject the null hypothesis when it is false, that's just going to lead the city to say, hey, we don't have significant evidence to determine that the mean time is improved, which means they're probably going to be more likely to continue to look for ways to improve and increase that or decrease that mean response time. So it's going to take some time and money, but that's going to, in the end of the day, help save more lives probably. So type 2 error is probably not the worst thing to cause here. So in this scenario, type 1 error is definitely worse than type 2. So the consequences of that are worse. So what can you do to minimize your type 1 error? Well, decrease your significance level alpha. Make it small so you're more likely to not reject your null hypothesis. Because if you're not rejecting it, then that's when the city's going to follow up and look to see what else they can do. Okay, so I talked about this thing called power relating to error, the type 2 error before. So let's look at that now. So power. What that is I have this big fancy definition here, but you can really think of it like this. Say we have someone's claiming that the mean test score is 75. Then we want to say, well, no, we think the mean test scores are really greater than 75. So if you assume that the true mean is actually something that the alternative supports, so maybe it's like 80, then whatever the power is, it's the probability that we're going to find evidence to support that alternative hypothesis. That's really what the power is. So power is really a test of how well does your hypothesis test pick up these differences between what the actual parameter you're interested in is versus that null hypothesis you've assumed. So is it sensitive enough to pick up small differences? So the three things that can manipulate power are going to be as follows. The significance level, which I mentioned before. If I have a small significance level, the odds of me rejecting my null hypothesis are not that high. So you can see in this picture here with my significance level of 0.05, the blue area represents the curve for what's actually the probability distribution. So my power is the area there, that's 80%. If I increase the significance level, I make it more likely for me to reject the null. So in turn, I'm going to increase the area under that alternative hypothesis probability curve here. So I'm increasing the power here. So this is the easiest way to increase your power, but it's going to really increase your type 1 error. The second thing is, well, how big is the difference? If the difference between the true parameter that the alternative hypothesis supports is far away from what that null hypothesis is claiming is, you are going to have a larger power than if these values are really close. so you can see the difference in area under the curve based on how far apart they are. So power is all about how well is your test at detecting small differences. The third thing that affects power is your sample size. If I have a small sample size, my samples are all going to have more variability, so I'm going to have these stretched out probability distribution curves. But if I look at a larger sample size, my samples are going to be less variable. I'm going to have a smaller standard deviation, which means I'm going to get these tighter curves, which will result in more area under the alternative hypothesis curve being picked up, so your power increases. So these are really the three things you want to think about how power is affected and what it really does. So I hope you found this video on type 1 and type 2 errors helpful. If you did, smash that like button and have an awesome day.